Thank you, Governor, for the kind words. So good afternoon, everyone. My name is Phil Chan. I'm an infectious disease doctor at the Rhode Island Department of Health. Pleased to be here, back with you again on behalf of Director Alexander Scott and the Rhode Island Department of Health. So Dr. Alexander Scott usually starts things with an overview of the data situation, and so that's where I'll begin. We had 264 new cases yesterday out of over 19,000 tests. That's a percent positive of 1.4%. We had a weekly percent positive of 1.9%, which is really, really good. In fact, that is the lowest percent positive we have had since the week of October 11th, before we saw our increase and, of course, the terrible second wave that we had in the winter. So we're in a really good place right now, to echo what the governor mentioned. These are case numbers, and again, we can be cautiously optimistic about them. Our fatality numbers and our hospitalization numbers are also down as well. And those decreases are most pronounced in the groups that have high vaccination rates. So the vaccine is working. And that's a theme that you're hearing from the governor, from myself, and you'll hear from Tom as well. For example, our hospitalization rate for people 60 and older is down 80% from its peak during early December in Rhode Island, 80% in people over 60. And yesterday, the CDC released some data that confirmed this trend. The CDC is seeing that fully vaccinated people, adults 65 years of age and older, are 94% less likely to be hospitalized with COVID-19 than people at the same age who are not vaccinated. In that same study, the CDC also found that people 65 years and older who were partially vaccinated were 64% less likely to be hospitalized with COVID than people who were not vaccinated. So what do these numbers show? There's two takeaway messages. One is that these vaccines are extremely, extremely effective. They work, and we know that from the data and now from our real-world lived experiences here in Rhode Island and across the country. The second thing that I want to emphasize is that people really still need to get their second shot of the vaccine when it comes to the Pfizer and Moderna vaccine. That second shot really boosts the efficacy, and it's going to be much more effective against those variants, which are circulating around the world and which we still continue to be a little bit worried about. And of course, people who have not received any doses of vaccine need to get vaccinated. There are also some practical benefits to being fully vaccinated. For example, if you are fully vaccinated, you do not need to quarantine if you are a close contact to someone with COVID-19. You still need to monitor for symptoms, but you do not need to quarantine. You also do not need to quarantine after coming back to Rhode Island from a hotspot state if you have been fully vaccinated. Another benefit is that fully vaccinated people do not have to wear a mask outdoors as long as they can keep at least 3 feet from others, as the governor shared. So these are all benefits of being vaccinated, and we know that people who are vaccinated are less likely, very much so, less likely to be infected. As a reminder, being fully vaccinated means that you are at least 14 days from that last dose of your vaccine. So 2 doses again from Moderna, Pfizer, 1 dose for Johnson & Johnson. On the top of the vaccine, one important update that I want to share is what's happened with the Johnson & Johnson vaccine, and the fact that here in Rhode Island, we're going to be restarting the administration of the Johnson & Johnson vaccine in Rhode Island this week. As most people know, the FDA and us here in Rhode Island, based on that, did pause the administration of the Johnson & Johnson vaccine earlier this month. That was after the FDA, the CDC, identified 15 cases of something called thrombosis, that means clots, with thrombocytopenia, that means low platelets, in people who had received the Johnson & Johnson vaccine. This was among millions and millions of people who were vaccinated. These reports and the benefits of the risks and the benefits were all carefully reviewed by the CDC, by the FDA, by us at the Rhode Island Department of Health, by our vaccine subcommittee, by teams of doctors and scientists. And last week, the FDA and the CDC did recommend that states can restart administering the Johnson & Johnson vaccine. Healthcare providers are now aware, including in Rhode Island, of this extremely rare health event and how it should be reported in treatment. We've done a lot of work at the Department of Health across the last week in updating providers, physicians, nurse practitioners, PAs, others, about how to report and identify the risk of this thrombosis with thrombocytopenia. And as Dr. Alexander Scott mentioned last week, this is why these safety systems are in place, and the fact that we even identified initially 6 cases of this across millions and millions of people being vaccinated shows that these safety systems are working, and that's certainly a comfort to me. My message today is still 100% to get vaccinated. If you have questions about the Johnson & Johnson vaccine, please do talk to your healthcare provider. If you believe that you're at risk of clots or other clotting, keep in mind that we also have the Pfizer and Moderna vaccine, which do not have the risk of clots that we know of. So 2 other vaccines, even if you don't feel comfortable getting the Johnson & Johnson vaccine. And as I shared earlier, the case data is promising. We're really in a good place. Things are trending in the right direction. But unvaccinated people are still at considerable risk. And this is because of the variants, including B.1.1.7. We know that variants like B.1.1.7 and others are more contagious. And that's why we're still seeing hundreds of new cases every day. And with that in mind, I do want to reiterate that in addition to getting vaccinated, you can substantially reduce your risk of infection of COVID-19 by gathering with people, if you do, outside and not indoors. And I really want to emphasize that. As this pandemic has progressed, we have realized the importance of just outdoor ventilation. So if you had to pick among many different things, gathering with people outdoors is really one of the best things you do compared to a smaller indoor enclosed setting. And as the director shared last week, we've been talking about a lot of restrictions and those being loosened. I want to be clear, too, that you can always choose to be a little more cautious and careful compared to what we're suggesting. That's okay. Again, what we're talking about up here are the minimums that people have to adhere to, but people can always choose to be more careful and more cautious. If you do want to be more careful in terms of wearing masks outdoors or keeping your group small, that's totally fine, certainly from a public health perspective. And personally, in a lot of scenarios, again, my family and I have a 10-year-old and a 13-year-old, soon to be 14, continue to go that route. So as we know, the vaccines are only approved for individuals 16 years and older. And so as a parent, as a father, I do continue to be somewhat careful given that my kids cannot be vaccinated. I am optimistic, as some of you may know, that in the coming months, we should see vaccines, especially for 12 to 16 years of age and older. So vaccines for children, for adolescents younger than 16 are in the very near future. More to come on that, and obviously a good note. And finally, I just want to end by thanking all my colleagues at the health department, also in the healthcare field across the state, and also all of state government for their work on the pandemic. There's literally thousands of people involved in this effort. I'm up here representing some of them, but just want to really send a heartfelt thank you to all of them.